mental illness and physical illness, they go hand in hand. And it's not a weakness to say that you need help, and it's okay to reach out for that help. And I think that's something that we all need to remember. Josette, I have my next question is for you. It's about frontline workers. And this question came from a frontline worker, especially healthcare workers. They're experiencing heavy stress and unique traumas at work. What are some tips for dealing with the long hours, demanding shifts, and anxiety about catching COVID-19?
Right, great question. So I would think about, given the enormous personal sacrifice made by frontline and healthcare workers, the focus when they're not working really needs to be on their own self-care. And so the goal, sort of in an ideal world, would be to try to be as emotionally and physically healthy as possible during this time by really practicing safe and healthy habits. So when I'm using the phrase self-care, good self-care, I'm meaning ensuring they're able to get as adequate sleep or as much sleep as possible, eating healthy food, having even time for small amounts of exercise if possible. I know hours are limited. Other healthy strategies would include getting time outside, if at all possible, time to talk with close friends or family members to process some of the stress of their work and get some emotional support. And in particular, around the work stress, talking with friends or coworkers who can really validate what their experience is, because they have a unique experience being on the front line. And that can be very helpful to not feel so alone and isolated in the experience. And for sure, if they're feeling too overwhelmed to cope with the demands of the position, reaching out, again, whether it's to coworkers, friends or families, or some other mental health professional or group or organization.